Hello, I'm Dr. Pelto, and in this episode of Healthy Living, we're going to focus on practical tips for a healthier life as a diabetic. Let's get started and talk about a few simple ways you can prevent getting a foot wound. You may not know, but just because you have diabetes, you have a greater risk of developing a foot wound, also known as an ulceration. Wounds of this kind typically begin as a blister on the bottom of your foot or between your toes. They can become infected, and if the infection is serious, lead to losing a portion of your toe or even your leg. Here are the easiest and most effective ways you can prevent an ulceration. To start, I cannot emphasize enough the importance of self-examination of your feet, both the tops and the bottoms and between your toes. A mirror can be very helpful, but if you're unable to see all aspects of your feet, it's best to have a loved one help. For those that are high-tech, I've seen my patients use an iPad and they take it and place it on the floor and then they make a video recording to see if they have any problems on their feet. Anything you find that appears abnormal or strange looking should be evaluated by a professional, such as dampness between the toes, blistering, a new callus, an area of redness, ingrown toenail, or cut or scrape. Even if you see your podiatrist only every 2 to 3 months, it's recommended to go see them sooner if you have anything that's of concern on your foot evaluation. Next, we're going to talk about what you should wear on your feet as a diabetic. Specific shoes that are extra depth are specially designed to help diabetics avoid ulcers, which, as we've seen, can lead to very serious medical problems. Medicare and most insurances provide coverage for these kinds of shoes. For insurance companies, this coverage of giving people shoes can save them thousands of dollars that treatment of an ulceration can ultimately cost. And an amputation? Well, that's 10 to 20,000 times more expensive than treating the wound in the first place. So who can get diabetic shoes? Generally, diabetes by itself isn't enough. You have to have one of these things we call risk factors that make you at higher risk of an ulceration. Let's look at these dangerous risk factors. The first thing, you may have swelling or a lack of a pulse in your feet can be a sign of poor circulation. Here's a simple test. Press on the tip of your big toe, and if the spot where you pressed becomes white or blanches and then the red quickly returns, your circulation is probably normal. If you're unsure how your circulation is, it's good to go to a podiatrist who will evaluate your pulses. There are 2 main pulses on your foot. One is found on the top of the foot, called the dorsalis pedis artery, and the other one is found behind on the inside of your ankle, called the posterior tibial artery. If your pulses cannot be felt on your feet, you may need a more specialized exam by a physician. In our office, we use a device called a Doppler to help us listen to the flow in the blood vessel. Here is an example of the sound of a Doppler. If the sound of the blood flow is good, it's going to sound like a swishing sound. If the blood flow cannot be heard, there is another test that can be done that uses blood pressure cuffs of different areas of your leg to determine the flow of your blood. Another reason that diabetic shoes are covered for you is if you have a foot deformity. No one likes being considered deformed, but this is merely a technical term for any type of foot or bone abnormality that could cause rubbing in your shoe. This can cause blistering and lead to very serious problems. Extra depth or diabetic shoes can help. The common bony prominences are called bunions, as you can see in this picture, and also the toe next to it, the second toe, has a hammer toe. Other problems can include a longer toe, a collapsed foot, and these deformities generally are sufficient for insurance to pay for a diabetic shoe for many people. Something else to look at is your sense of feeling or touch on the bottom. If it's compromised, you're at greater risk for stepping on an object that can penetrate your skin. This issue of poor feeling is called neuropathy. Some people with this neuropathy don't have any pain, but others had a lot of pain in their feet and their legs. Now, however, if you have neuropathy, you have some reduced sensation, and you may not know that you're scuffing the bottoms of your feet, which can produce a callus or a wound without knowing it. We can test the feeling of your feet using a little plastic device called a 10-gram monofilament. Here's an example of this little device. This is a thin plastic wire where you gently poke on areas of the bottom of each foot. And if you're unable to feel these pokes in uncalloused areas of your skin, you probably have some level of neuropathy or poor feeling, which qualifies you to obtain diabetic shoes. Also, if you've ever had a wound or ever needed a partial amputation of a toe, you are at greater risk for developing other problems in the future. This probably indicates that you have some or all of the conditions that we mentioned previously. Usually a foot wound is not caused by one isolated problem, but rather a combination of problems that led to a wound or an amputation. These are the top health risks that qualify you for diabetic shoes. Other factors can be involved, but most people who have these conditions would qualify for diabetic shoes. Finally, I want to talk to you about calluses on your feet. If you develop a callus on the bottom of your foot or on the sides of your toes, it can develop into a wound quite easily. The proper treatment for calluses is trimming them with a specialized instrument. This should never be done at home on your own. Only a podiatrist should trim your calluses. For mild calluses on the bottom of your foot, specialized callus creams and pumice stones can help. A word of warning: do not use callus removers. They contain a strong acid, and the acid is not able to determine what is normal skin or what's thickened callus skin, and it can't determine how deep to penetrate in your skin. If you have poor blood flow or poor feeling and use these treatments, they very commonly cause wounds. Instead, a lighter and safer cream is available that can reduce some of the calluses. But if the calluses seem to be getting thicker, consult your podiatrist about proper treatment. If you would like more information on taking care of your feet with diabetes, please visit drpelto.com and click the link for healthy living, and you're going to find more resources there on diabetes. Hello, and welcome to Healthy Living. Now we're going to break down the different aspects that are involved in a diabetic foot exam. You're wise if you have your podiatrist perform a complete diabetic foot exam at least once a year. This exam is used to assist your primary care physician as well as your endocrinologist, much in the same way an eye doctor's exam is shared with your primary care physician. Depending on your risk factors, your podiatrist may need to conduct this exam more frequently. How often should you have this exam? Here are the basic guidelines for the exam. If you have no neuropathy, no circulatory problems, and no foot deformities, you should consider getting a diabetic foot exam just once a year. If you have some loss of sensation, which is also called neuropathy, you should be seen every 3 to 6 months for a diabetic exam. Now, if you have poor blood flow and neuropathy, you're probably being seen by a specialist every 2 to 3 months. And then finally, if you have a history of an amputation, you should be seen more frequently, probably every 1 to 2 months by a specialist. As you may have observed, the more diabetic risk factors you have, the increased frequency of the foot exams. A diabetic foot exam is an 8-step assessment. It looks at your skin, your blood flow, your nerves, your past medical history, and the risk factors that could lead to serious problems, including amputation. Let's look at each step in more detail. The first step in this exam is to review your medical history. Like most medical exams, we need the basic information, including the name of the doctor that's supervising your diabetes. That may be your primary care physician, an internist, or an endocrinologist. This is important to know in case we have to communicate with them about your foot health, as well to send the notes after your exam. Next, it's important to know when you had your last foot care appointment. Depending on your symptoms and risk factors, this should be performed every 2 to 3 months. Also, what other health conditions do you have? This is important to know, as other conditions can affect your diabetes and also can cause neuropathy. And how about your medications? Are you on any new medications, or have you switched any medications? And what type of insulin do you take? What diabetes medications do you take? And what was your last fasting blood sugar? And how about your last hemoglobin A1C? All these are important. This last blood test, that's called the hemoglobin A1C, is usually done every 3 months by your endocrinologist or primary care doctor. It indicates your blood sugar over the last 3 months, not the single moment in time as in a finger stick test. The hemoglobin A1C is a better gauge of how your blood sugar has been over a long period of time. Now, how long have you had diabetes? If it's not properly managed, the longer you've had diabetes, the higher risk for complications. And then we like to look at how much exercise are you doing. After we review this information, we can make recommendations as needed, focusing especially on the type and level of your physical exercise and your shoe gear that's safe for you. Now next, for step 2, we perform an orthopedic or bone structure evaluation. We look at any bones that are more prominent on your feet, as well as hammer toes or other curved or bent toe structures, as you can see in these pictures. Equally telling are bony prominences, which can cause shoe rubbing and ulcerations on the bottom of your foot. One area of specific concern is something called Charcot foot. This is a potentially severe condition in which the arch of your foot collapses. In this picture, you can see a normal foot and a Charcot foot that has a collapse in the middle. Many times this condition of Charcot foot can be mistaken for an infection and may lead to an ulceration because of the bony prominence. Many times in the beginning stages of Charcot, your only symptom may be a red, hot, swollen foot. It's always important to consider Charcot early in your diagnosis if you have diabetes and neuropathy. The next phase is to look at the skin on your feet to see if there are any areas of callous skin, cuts, or dry skin. It's important to see if you have any athlete's foot or thickened or ingrown nails. Talk to your doctor if you have had a foot infection in the past or if you have ever had gangrene on your foot. An essential part of examining your feet is to look between your toes and note the temperature of your feet. The next step tests the nerve sensation of your feet, including vibration, light touch, and distinguishing between sharp and dull feeling. We use a special instrument to check how well you perceive sensation, and this is called a Sims-Weinstein or a 10-gram piece of monofilament plastic wire. We touch its end to different areas on the bottom of your foot, and if you're unable to sense touch to any of these areas, you have lost what's called protective sensation. This means that you are at high risk of developing a foot wound, which may lead to more serious problems and ultimately to amputation. Without protective sensation, you might step on something dangerous, such as a pin, a rock, or an object without knowing it, and possibly cause serious problems for your feet. The next step to the exam, we look at how well your blood flow is. We examine your blood flow, and the pulse is on the tops and on the sides of your feet. We also look for swelling in your feet. At home, you can perform an easy test yourself. Simply push on the tip of your big toe, and the toe's natural pinkish color will return from white. If the pink returns in less than 3 seconds, you can rest assured that your circulation is not a problem. Poor circulation signals the need for other, more formal exams by your podiatrist. The final step in this exam looks at what you wear on your feet. A shoe exam is very important. Do you look at your shoes before you put them on? If you don't, you may be at greater risk for getting a cut or a wound on your foot. Often small items, sometimes sharp or abrasive, can fall into your shoe. If you don't feel them, because of the problems we've already discussed, you may develop bigger problems down the road. We also look at the type of shoes you wear to see if they are appropriate for you as a diabetic. We then compare the results of your examination with those of many other patients. If you were recently diagnosed with diabetes and have no risk factors, a yearly exam is generally sufficient. But if your risk factors intensify, such as you start to lose the feeling or you don't have a pulse that can be felt, we will recommend more frequent exams. I'm sure you will agree that more frequent foot care exams are far less inconvenient than developing a foot wound, infection, or worse. Finally, we spend considerable time explaining the risk factors of diabetes and the vital importance of controlling your blood sugar. We're going to review the dangers of neuropathy and explain the findings of your comprehensive foot exam. Most importantly, we teach you how to do a daily self-examination of your feet. That's the best thing that you can do to prevent an amputation. If you have not had a comprehensive foot exam, it's wise for you to contact your podiatrist today to schedule one. If you'd like more information on taking care of your feet with diabetes, please visit drpelto.com and click on Healthy Living, and you're going to find resources there about diabetes. Hello, and welcome back to Healthy Living. I'm Dr. Donald Pelto, and I want to discuss now the 4 serious foot care mistakes that people with diabetes typically make. Mistakes are common in life, and we all make them. All mistakes, though, have consequences, sometimes minimal, but sometimes quite severe. In treating thousands of individuals with diabetes, I've found that they make mistakes that are quite common. Some mistakes, however, can be tragic. Unattended, the more severe the mistake, the greater the risk of foot wounds, amputations, or even death. I'd like to say that diabetes resembles a forest fire during a drought. A small flame, even a spark, can fuel a great forest fire. Similarly, a small cut or one self-care mistake can end up taking a limb or even your life if you have diabetes. The first mistake I commonly see is people trimming their own calluses. I strongly advise against trimming your own calluses if you have diabetes. If you have a lack of sensation, also called neuropathy, or if you try to use an improper instrument, you can cut past the callus and into your skin. That can be slow to heal or even could get infected. The best treatment is to have your podiatrist trim your calluses regularly. Some commercially available callus creams can reduce the hardness of your skin, but I'd like you to stay away from any acid products that are called callus removers, and try to eliminate the cause of the calluses as well. Are you walking too much with improper shoes? Are your shoes too tight, or are they rubbing? Is there excessive friction on the bottom of your foot? If the calluses are on the bottom of the foot, you should consider footwear designed to reduce the friction. In many cases, your healthcare insurance will pay for these shoes. The second mistake I see is that people only think they have a problem if they feel pain. You probably only go to the doctor if you feel sick or if something hurts. Unfortunately, that's not the way it works for your feet if you have diabetes. If you only recently have been diagnosed as having diabetes and you have some loss of feeling, your foot may be injured, but you may not feel any pain. Don't wait for pain before you go to the doctor to have your foot evaluation. Check your feet daily or have someone else check them. If you can't see the bottom of your feet, try using a mirror. And if you see something during your daily foot exam that doesn't look right, see your doctor immediately. And the third mistake that I see is that people with diabetes try to remove their own ingrown toenails. Due to a lack of pain or sensation, people with diabetes can develop an ingrown toenail and they don't even feel that they hurt. If your nails are thick due to a fungal infection, you may be more likely to develop ingrown toenails. If you see an ingrown toenail, you will notice the side of your toenail growing into the skin. At times, you may see yellow or white pus, and your toe may or may not be red. Many times, it will not be painful either. The best way to determine if you have an ingrown toenail is to look at your toes or have someone else look at them. If your nail can grow past your skin edge of the tip without difficulty and not creep into the edge of the skin, you are probably okay. But if your nail grows into the edge of the skin, and if you find yourself digging out the edge of your nails when you trim them, you should see a podiatrist. The best way to prevent an ingrown toenail is to let the nail grow forward past the skin and trim it straight across. Don't trim it into the edges. Also, many people with diabetes see their podiatrist for nail care to prevent the occurrence of ingrown toenails. Healthier diabetics may even be able to have a procedure to kill the root of the nail to prevent the ingrown toenails from reoccurring. This is not for everyone, and you should ask your podiatrist if it's an option for you. The fourth mistake I see is people wearing worn out or improper shoes if they have diabetes. People in general tend to wear their oldest shoes for the hardest work. the dirtiest work that they do. Unless it's your job, when you're gardening or doing construction work, you tend to wear your oldest shoes. For diabetics, however, wearing an old, worn-out shoe at any time can cause serious problems. First, your shoe size may have changed over time. And as you age, a shoe that fit about 5 or 10 years ago may not fit any longer. Also, the leather, it can harden over time. A shoe that used to stretch in order to be comfortable can become hardened and develop places that rub excessively on your foot. Therefore, diabetic shoes are often your best option. But if you wear regular shoes, make sure they are shoes that you're used to wearing. All shoes you should wear should be comfortable from the day that you buy them. You shouldn't have to break them in. Inspect your feet every few hours when you buy a new shoe to see if there's any rubbing that can cause blistering or pain. As you can see in this picture, an area on the side of the foot that's red and inflamed from the bunion is from rubbing. If you experience any of these, you should return your shoes to the store. Please, get rid of these shoes. Inexpensive shoes may save you a little money initially, but if they rub you the wrong way, literally, you can cause a sore on your foot. Bad news, don't wear shoes that don't fit. If you would like more information on taking care of your feet with diabetes, please visit drpelto.com and click on the link for Healthy Living, and you're going to find resources on diabetes. Hello, and welcome back to Healthy Living. Now I'm going to give you the best 4 questions you should ask your podiatrist about your feet if you have diabetes. The first question is, why are my feet tingling or burning? Many times, tingling and burning are signs of neuropathy or nerve damage. You need to know from your doctor if you have neuropathy, if your sense of feeling is good, poor, or borderline. If you have borderline neuropathy, your podiatrist should evaluate your feet at least yearly. I like to explain neuropathy like this. It's kind of like a failing light bulb. One day the light is working well, the next thing you know, it's starting to flicker, and finally it goes out. You never know when the light will go out, and you never know when your neuropathy will become worse. If you have painful neuropathy on your feet, there is medication that's available. Ask your doctor if this can help you. As well, there are some topical medications that may relieve some of the burning and tingling pain on your foot. The tingling and burning are actually signs that the nerves in your feet are dying. If the pain disappears, that means the nerves have stopped working. Therefore, painful neuropathy in your feet is actually better than no pain and having no feeling. The second question I think you should ask your podiatrist is, how is your blood flow to your feet? You need to know how well your blood flow is circulating in your feet. Poor circulation can signal a need for another exam to verify the flow of blood. An exam called an ankle brachial index involves putting a blood pressure cuff on your arm and then on your leg, and it helps to determine if there are any blockages. There's another exam called a magnetic resonance arteriogram. That's a big word for an MRI of the arteries. This is a more advanced exam that determines, as you can see in this picture, exactly where the blockages are in your arteries. This exam is usually performed by a vascular specialist. Even though you have poor blood flow, you may or may not feel anything. Many people do not realize that they have poor circulation until they develop a sore on their foot that's slow or unable to heal. Often people with poor blood flow to their feet feel pain in the back of their calves or in their buttock area after walking a certain distance. For example, if you walk a block but you have to stop and rest, then you can walk another block. That's called intermittent claudication. That is a sign of poor circulation to your legs. As your blood flow becomes worse, you may even have pain when you're just standing and resting in bed. The more severe these symptoms, they can make it more difficult or even impossible for you to walk. Sometimes poor blood flow can even be masked as pain in your back. If you have concerns about your blood flow, you should make an appointment with a vascular specialist. The third question you should ask your podiatrist is if you can get a pair of diabetic shoes. If your healthcare insurer will pay for diabetic shoes, I recommend getting them. To qualify for this healthcare benefit, you need to have risk factors. These include poor blood flow, poor feeling in your foot, or foot deformities. If you have one or more of these symptoms, normally your insurance will pay for a pair of diabetic shoes and 3 sets of inserts each year to prevent the complications of diabetes. I know many of you think diabetic shoes are ugly. That may have been accurate at one time, but shoe companies have come to realize that competition leads them to offer products that are both more attractive and good for you. No one wants to wear a Frankenstein-looking shoe. There are many fashionable diabetic shoes that are now available, bearing popular brand names like New Balance and Hush Puppies. You may find that shoes with Velcro or stretch closure are easier to get on and fit you better, especially if your feet are very swollen and you can't easily reach your feet. The last question you should ask your podiatrist is what you should do if you have a foot problem. Many diabetics experience some type of emergency during their lifetime due to blood sugar, foot, or other health conditions. It's important to find a trustworthy group of doctors to help you when problems arise. Your doctor should be able to see you the same day if you have a foot problem. If not, you should go to the local emergency room. If you have diabetes, here is what you should consider an emergency: a cut or a wound on your foot that's new, a painful or non-painful ingrown toenail with infection, redness or streaking on the skin with infection, and feeling pain in your foot when you usually don't have any feeling. And finally, if you have symptoms of fever, nausea, and vomiting without any apparent cause. If you have any of these conditions, you need to be seen as soon as possible by your doctor or go to the emergency room. If found too late, you risk a complication or infection on your foot, which sadly can lead to an amputation. If you would like more information about how to take care of your feet with diabetes, please visit drpelto.com and click on the link for Healthy Living, and you're going to find more resources there about diabetes.